Have you ever really stopped to think about how that pill you swallow or that patch you put on actually works? Well, in this explainer, we're pulling back the curtain on the incredible, secret science of how medicine actually gets where it needs to go.
Right. Let's just dive straight in. Because you've probably wondered, why can't everything just be a simple pill? It turns out the way a medicine is delivered, whether it's a pill, a patch, or an injection, is just as important as the drug itself. There's a brilliant strategy behind every single choice.
So to get our bearings, you gotta know that pretty much every way we get medicine into our bodies falls into two big buckets, what we call local and systemic.
Okay, think of it like this. A local route, that's like a sniper. It's designed to hit one very specific spot, like a skin cream on a rash, and that's it. But a systemic route, that's like putting a message out on the national highway system. The medicine gets into your bloodstream and travels literally everywhere.
Now, the one we're all most familiar with is, of course, the pill. That's called the oral route. And while it seems super simple and convenient, it has a massive, massive problem to overcome.
And look, it's the go-to for a reason. It's generally safe, it's pretty cheap to make, and it's just plain easy for all of us. But, and this is a big but, for a lot of drugs, it's just not very effective.
And that brings us to the villain of our story, this thing called first-pass metabolism. Get this name in your head because it's the #1 reason why a simple pill just won't cut it sometimes.
So what on earth is this first-pass metabolism? Well, when you swallow a pill, it gets absorbed from your gut into blood vessels that make a mandatory first stop at the liver. And your liver, it's like a hyper-efficient security checkpoint. It sees this drug as a foreign substance and immediately starts to break it down and filter it out. So a huge chunk of the medicine is destroyed before it ever gets a chance to do its job. It's like the liver charges a massive tax on the way in.
And for some drugs, this liver tax is unbelievably high. We're talking about really important medicines for heart conditions, potent painkillers, even anesthetics. Taking them as a pill would be a total waste. It would be like sending out a fleet of 100 delivery trucks, knowing full well that 90 of them are going to get stopped and taken off the road at the first checkpoint.
So how in the world do doctors get around this problem? Well, this is where the science gets really cool. They figured out some incredibly clever routes that act like a secret express lane, completely bypassing the liver's toll booth.
First up is our hero, the sublingual route. It sounds fancy, but it literally just means under the tongue. See, you have this rich network of tiny blood vessels right under your tongue. By placing a tablet there to dissolve, the drug gets absorbed straight into your bloodstream, completely sidestepping the gut and that first trip to the liver. No tax.
The amazing things about this are speed and control. Because you're bypassing the liver, the drug acts incredibly fast. That's absolutely critical in an emergency, like using nitroglycerine for chest pain. And get this, the patient is in control. As soon as the medicine has done its job, you can just spit out the rest.
Okay, next up, the transdermal route. We're talking about the patch. It works for certain drugs that are what we call lipid-soluble. Basically, they're oily enough to slip through the fatty outer layers of your skin and get absorbed by the blood vessels underneath. It's like a slow, steady, continuous drip feed of medicine.
And its main superpower is providing a really constant, stable level of the drug in your body over a long period. This is perfect for things like a nicotine patch or for managing chronic pain. You avoid all those uncomfortable ups and downs, the peaks and troughs that you can get from taking pills every few hours.
All right, now the rectal route. It might seem a bit unusual, but it is an incredibly important and useful method. And the reason is the blood supply in that area is unique. It gives us another clever way to partially get around that pesky first-pass metabolism.
So here's the key thing to know. This route avoids about 50%, half, of the liver's filtering effect. That is a massive improvement over a pill. It's why this route is so vital in certain situations, like for giving seizure-stopping medication to children quickly and effectively. Okay, now let's talk about a totally different approach. Two routes that are pretty fascinating because they use the very air we breathe to deliver medicine with some serious speed.
So your nasal passages and your lungs, they have this huge surface area that is packed with blood vessels. This creates a direct, super fast highway for drugs to get into your system. For something like an asthma inhaler, the effect is almost instantaneous. In fact, when you inhale a drug, doctors can control the delivery with the same kind of precision as an IV drip. It's incredible.
But if all those other routes are clever bypasses and express lanes, there is one route that is the absolute, undisputed superhighway. It offers a complete 100% bypass of every single barrier.
And that, of course, is the intravenous route, or IV.
When a drug is injected directly into a vein, it is put straight into the bloodstream. That means 100% of that dose is immediately available for your body to use. There's no waiting for absorption, there's no liver tax, nothing. It is the fastest, most direct route possible, period.
So, after all that, what's the big picture? What's the main takeaway from all of this science?
Well, it's that the choice between a pill, a patch, a spray, or an injection is never, ever random. It is a highly strategic, scientific decision. It's all designed to control exactly how fast a drug works, how much of it actually gets to do its job, and how long its effects are going to last. All to make sure a treatment is as safe and as effective as it can possibly be.
So, the next time you take any kind of medicine, maybe you'll think about its incredible journey. Because from that simple-looking pill that has to fight its way past the liver, to a high-tech patch that delivers a steady, constant dose, there's always a hidden strategy at play. Thanks so much for watching.